Hello everybody, this is Cameron Giardini with Giardini Medicare, where we strive to be your transition to Medicare team. And today we are going to talk about a very popular vaccine for people that are probably new to Medicare or in their mid to late 60s. And you may have already guessed it by now, but the vaccine is the shingles vaccine. So there's a lot of confusion as to how it's different for the shingles vaccine versus some other common vaccines like the flu vaccine. And we're going to cover that in this video, talk about the coverages and the cost associated with getting a shingles shot on Medicare. So please stay tuned. We'll get into the details now and learn a little bit more about how that works. The first thing that's really important to determine before figuring out how much the shingles vaccine will cost you is first figuring out exactly which type of shingles vaccination you plan on receiving. So if you look here, there's actually two types of shingles vaccines, and the first one is called Shingrix, with the second one being called Zostavax. Yes, they are both vaccinations for shingles. However, they are different medications and they come with different procedures and different costs. Shingrix is typically the vaccine that is recommended to most people that we see on Medicare. And this is because, as you can see, the CDC does recommend the Shingrix vaccine as the preferred shingles vaccination for healthy adults over 50. However, Zostavax is still used, but again, they both come with different costs and different procedures. So make sure you check with your doctor or pharmacist before getting the shingles vaccine and let us know exactly which one so we can help you determine those costs a little bit better. Some of the confusion with how the shingles vaccine is covered comes with how other vaccines are covered when on Medicare. So as you can see here, we'll look at the flu shot, which is obviously a very popular shot that you will receive while on Medicare. However, it is different than the shingles vaccine when it comes to coverage. So the flu shot is covered by Medicare Part B, which is your outpatient medical coverage associated with original Medicare itself. So if you have a Medicare Advantage plan or a Medicare supplement, this is going to be covered much differently than other vaccines that fall under Part D. So your Part B covered flu shot is going to be covered as a preventative procedure when you need to have it administered once a year while on Medicare. Now let's compare that to shingles, which many people think is going to be a no-cost or a very low-cost vaccine while on Medicare. However, as you can see, the shingles vaccine is not covered by Medicare Part A or Part B, and it strictly falls under Medicare prescription drug coverage Part D. So that is going to depend on exactly how you get your Part D coverage, whether it's built into an Advantage plan or if you get a standalone plan with Medigap. But again, the shingles vaccine is covered by your Part D prescription drug benefit and not by Part B, like boy, of Medicare. Now you may be asking yourself, why does it matter if the shingles vaccine is covered under Part D or Part B? And the answer to that question really comes down to how much it's going to cost you once you actually have it administered. So you can see here, this is an example from Medicare.gov using a Part D prescription drug plan, and it shows you the cost associated with either the Shingrix vaccine or the Zostavax vaccine. So here you can see the retail cost for Shingrix on this example is about $155, and then the Zostavax is about $230. And the most important part to consider here is that, again, if you go back to our other video talking about the Part D deductible, typically plans are going to have a deductible of around $400 to $435 during the upcoming year. So this means that you're responsible for the full cost of the vaccine up until that deductible is met. And part of that is because Shingrix and Zostavax, either one, are both considered Tier 3 medications on almost every Part D plan. So this means they are considered brand name medications, and you have to pay the full price of the medication up to the Part D deductible. So sometimes you may look at it and you may think, okay, well, it's only a $35 copay for a Tier 3 medication. However, that is assuming your deductible has already been met. So if your deductible has been met, if you have other expensive medications, you can go and expect to pay a $35 copay on this plan for Shingrix or Zostavax. However, please remember that if you have not met your deductible for the year, then you will have to pay the full price of the vaccine up till the deductible is met. And again, for more clarity on how exactly the Part D deductible works, check out our other video right here that will talk a little bit more about that. Another really important point to consider with the Shingrix vaccine especially is that the price you see here, the $155, that is actually something you will have to pay twice. And the reason for that is that the Shingrix vaccine is administered 2 different times for the complete vaccine to be effective. So you have to take this number and multiply it by 2 when you're looking at the total cost. So that may be something to take into consideration if you are at the end of the year. If your doctor says you need a shingles vaccine and it's December, you may want to wait until January to at least have them both count towards the deductible instead of having one for 1 year and then one for the other. So that's a huge thing that a lot of people don't take into consideration with Shingrix. And another thing is you may try to look at different sources, or you may look at different ways to cut costs on the vaccine. But if you look here on GoodRx, even with a coupon outside of drug coverage, you're still looking at about $150 as a cash price or as a discount price for the Shingrix vaccine. So typically you can save, maybe $20, $30 using the coupon. However, we would recommend just using your drug coverage and having that full amount count towards the deductible, just in case you do need other vaccines throughout the year that end up being expensive and counting towards your Part D deductible. So it's better to at least use your drug coverage, even though you're not getting a discount, because it will help chip away at your Part D deductible for the year. Now let's recap what we talked about with the shingles vaccine and different considerations to keep in mind when looking at how it is covered with Medicare. So the first thing to remember is that you need to know which vaccine you're going to receive before trying to figure out exactly how much it will cost you. Keep in mind that Shingrix is done in a 2-part series, so you will have to factor that into the cost as well. Shingles vaccines, it's very important to remember they are covered by Part D and not by Part B of Medicare. So check with your prescription drug benefits to see how much the vaccine will cost you once you get it administered. Along those lines, check your plan's deductible, figure out if you have already met that for the year, or figure out if you have not, and then it will help you determine how much you will pay out of pocket for the shingles vaccine. All the time we talk about coverage and we say that word coverage, and just because every single plan or every Part D plan does cover the shingles vaccine does not mean it's full coverage. So yes, a plan will say we cover the vaccine. However, if you haven't met your deductible, as you've seen, with that coverage, you'll still have to pay full price for the vaccine. Lastly, one way to avoid possible out-of-pocket costs with the shingles vaccine is to get vaccinated while on employer coverage if possible. So if you are retiring and coming up to Medicare age and you know for a fact that your doctor has said you will need a shingles vaccine, it may be beneficial to check with your current employer plan to see how the coverage for that vaccine will be before considering getting onto Medicare Part D coverage. We have had some people that jump right on Medicare thinking everything is fully covered, and then they really get some sticker shock when all of a sudden a 2-part vaccine costs them $300 on their Part D coverage. So again, these are just some things to keep in mind when it comes to the shingles vaccine. There's all different types of vaccines when it comes to Medicare. They are not all covered equally. Let us know if you have any other questions about different vaccines, and we can always help you out. Also, go to our website at gmedicareteam.com and let us know if you have any questions. Thank you.